All right, I am here with Dr. Jacob Krehbiel. We are in the Des Moines area, and Dr. Krehbiel about 6 months ago brought in an iTero scanner, and just wanted to ask him a few questions about that experience. First, what was your motivation when you were kind of considering and thinking about bringing this unit into your practice?
Well, we had, I guess, a number of reasons why we wanted to bring in the practice. Number one, I had two uncles that were dentists that actually had the unit, and they had nothing but good things to say about it. And so we wanted to be kind of on the leading edge, or have some of the state-of-the-art equipment in our office. And when my uncles both said that they highly recommended it, we thought we'd give it a try, because we had kind of a testimonial from somebody that's used it from an unbiased source. So another reason is we thought, maybe from a cost savings, because we do use so much PBS impression material, we thought that that might also be a good reason to use. Another reason would probably be just the simple fact that patients hate PBS impression.
So tell me about that. You've had a number of patients that have probably been through the impression material, whether that be for restorative care or for Invisalign care, and now they're getting scans done. What's the feedback you're getting from patients specifically?
I mean, I think that most patients feel like because it is a digital scanner that they are getting the best treatment. With the scanner, it doesn't take any less time. So as far as the amount of time that is utilized, it's about the same as PBS. But I have had many patients say, boy, that's a lot better than that yucky putty you guys used to put in my mouth. And
sure.
I'm shocked at how many of them say it tastes so bad. So obviously with the iTero scanner, there's no taste.
Sure. And then from a clinical standpoint, whether it be fitting a crown or the restorative treatment, as well as the fit of your aligners for your Invisalign cases, tell me a little bit about the clinical benefit.
It's second to none. Yeah, you really can't compare the two. After we started using the iTero scanner, I felt like the crowns were seating so much better. The biggest issue was being able to take them off. When we try them in to make sure that the margin fits and that we've got tight contacts and check the occlusion. After that, it's very difficult to run an Explorer underneath the margin because the fit is so exact. So I really felt like the PBS material was almost below the standard of care, because if you've got a digital scanner out there like the iTero that's available, there's really no reason you shouldn't be using it, because it's going to give you the most accurate impression, whether it be for crown and bridge or Invisalign. We noticed that when we got the aligners back, almost the same issue there was that they fit so tight it was difficult to take them off. But there was never concern about there being distortion in the impression, because it's a digital scan. There's no error.
Tell me about your part of this. Do you put the device in your hand often, or is it an assistant that's doing most of your scanning? How's that work?
I use it to scan the crown or the tooth that's been prepped, or the bridge prep. So I'll actually scan those individual teeth myself. I typically have the assistant scan the opposing arch, and then once I've got the scan of the tooth and then the mesial and distal contacts, I allow the assistant to go ahead and scan the rest of the arch. So,
okay.
And then with Invisalign, they're scanning the entire upper and lower arch.
Okay, great.
I've already had the dental assistant enter in all the patient's information, so we're already ready to go. That typically takes just a couple minutes to enter the name and what area we're going to be scanning. With Tammy here, she's an Invisalign patient, so I'm just going to show you exactly how we would scan the lower arch. It actually tells us up here on the computer monitor, lower left buccal, occlusal, terminal molar. So we'll go down here, lower left buccal.
So it's just stitching it together as you go.
Yeah. Normally with an Invisalign, like I said before, I would have my dental assistant scan all this in.
Okay, so you have two hands on wand, watching the screen, and then using the foot pedal is what's actually then triggering the picture to be taken?
Yep.
Did you find this took a little bit of time to just get acclimated to, or was
no doubt, just like anything else, there's a certain learning curve to it. Once we got comfortable with it, it seemed like we were a lot more efficient. We're scanning complete arches in 15 to 18 minutes now. And we've got all the dental assistants are capable of doing it. We do have one dental assistant that probably does more scanning than any of the others. So.
Well, one thing I heard kind of from other potential interested customers is the size of the wand itself, and I know that was a hesitation always at first, but once you get it in the mouth, what are your thoughts on how it works?
I mean, it's bigger than a handpiece, but there's it's relatively ergonomically designed for your hand. So once you get used to it, you don't think twice about it.